Hello everyone and welcome back to lecture series on Economic Survey 2022-23. This is lecture number 10. In this lecture, we are going to cover two very important topics of Economic Survey, chapter number 6 and chapter number 7. Chapter number 6 talks about social infrastructure and employment, and chapter number 7 talks about climate change and environment. They say that knowledge is power. The beauty of these two topics is it is going to give us a lot of knowledge, facts and ideas about what are the different plans, programs and schemes of Government of India related to social sector as well as environment. One should be very careful when one is preparing for competitive exam like UPSC because we are going to encounter a lot of facts, lot of data, lot of figures. Are we going to memorize every data and fact that we encounter during our preparation? No. We should divide the data and fact into two categories. There is basic minimum data and fact that we should memorize. Then there is another set of data and fact for which we should understand the trend, that whether something is increasing, decreasing or something is constant. This is how we should divide the data. So in this topic, let us see how we can apply this funda to understand different type of schemes and programs by Government of India. To create the framework for this lecture, I have integrated chapter number 6 and 7. And we are going to divide this lecture into three different parts. In the first part, we are going to analyze the development indicators to look at various aspects of social development in India. For example, we would study Human Development Index, Gender Inequality Index, Multidimensional Poverty Index, and then we would look at different sectors. For example, health, education, skill, employment. We are going to look at employment from two angles. First is demand side and second is supply side. And then we will look at the labor reforms and basic needs. For example, what are the basic needs that everybody requires? So for example, electricity, water, house, all these things. So we are going to look at it. Then we will look at the rural development and various aspects of rural development in India. So for example, we'll look at aspirational district program, National Rural Livelihood Mission, Jal Jeevan Mission, and all these schemes related to rural development. Then we would conclude this lecture by analyzing various steps taken by Government of India for climate change and environment. So for example, a National Green Hydrogen Mission, then something called as Green Bond, Sovereign Green Bond, and then LEAD IT. We are going to examine three development indicators. The first one is called as Human Development Index, second is called as Gender Inequality Index, and the third one is called as Multidimensional Poverty Index. To find out the socio-economic development of a country, we look at an index called as Human Development Index. Human Development Index is formulated using four indicators. The first is called as life expectancy at birth. The second is mean year of schooling. The third one is expected years of schooling. And the fourth one is gross national income per capita. The first one, life expectancy at birth, it shows how long the people are living in a particular country and how healthy their life is. The second and third together, they reflect the level of education in the society. And the third one is about the material living comforts called as standard of living of the society. These three indicators are given equal importance. And when we merge them, integrate them for a particular country, we give it a score. And based on the score of a country, we give a rank to the country. This shows the level of socio-economic development. If we look at the score of India and the rank of India, we find out three important things from this economic survey. So if you look at the score of India, it says 0.633. That has been the score given under Human Development Index. And if you look at the score of South Asian region, 0.632. So the score of India is better than South Asian region. And the rank of India is 132, which means India is doing better than other countries in South Asia in general. That is the first conclusion that we draw from this table. Remember, I told you that all the time we don't have to memorize the facts. Sometimes we have to find the trend and the messaging behind the data as well. The second thing that we find from here is that if you look at the average score of the entire world in Human Development Index, it is 0.732, average global score. India's score is 0.633. Economic survey says that over a period of time, India's score is coming very close to the global score. So we are reaching the global average. So these are the two important things that we find from this table. Now let us find out how is India doing in terms of gender equality. So to find out whether we discriminate against male and female, the gender inequality, we use an index called as gender inequality index. So gender inequality index measures the level of inequality between women and men in three different dimensions of life. The first is reproductive health, the second is empowerment, and the third is labor market. So for example, are we giving equal representation to women in parliament? Are they getting opportunities of livelihood? Are they getting wages at par with men? These are the things we try to capture here. Based on these three indicators, we calculate a score. The score of gender inequality index ranges from 0 to 1. A country which gets a score of 0, it means that there is no inequality in that country. And if a country gets a score of 1, that means this country is highly unequal and huge discrimination is there in the way we treat men versus women. Now, if we look at India, India's rank in gender inequality index is 122. Economic Survey says again that it is better than the South Asian countries, and second, we are coming very close to global average. Now guys, let us look at a very important measure of poverty which is calculated by United Nations Development Program called as Multidimensional Poverty Index. What is actually poverty? So UNDP says that poverty means deprivation. So if you are denied of something, then we will say that you are poor. So poverty, according to UNDP, Multidimensional Poverty Index, is measured using three indicators. The first is called as health. So if you are denied opportunities related to health, then you are poor. Second is education, and third is living standard. These three are the important dimensions of measuring poverty. So if you are denied of opportunities related to these three, then you are poor. So in the Multidimensional Poverty Index, we give equal importance to these three. So what is the weight given to these three? 1/3, 1/3, 1/3, equal importance. Now, living standard is calculated based on these indicators. So how many indicators are there? 6. 1, 2, 3, 4, 5, 6. For example, assets, electricity, housing, drinking water, sanitation, and fuel. So if a person does not have access to these, then we say that living standard is very poor for that person and that person is poor. So living standard is divided into these 6 different indicators, which means all the 6 indicators are equally important. So the weight given to them is 1/18, 1/18, 1/18 to each, because 1/3 is divided into 6 parts. How do we calculate education? So education is calculated using school attendance as well as years of schooling. So there are 2 indicators to measure deprivation in education. Similarly, there are 2 indicators to measure deprivation in health. First is nutrition and the second is child mortality. Now, how many indicators are there in total? 10, right? And how many dimensions of poverty are there? 3. And these are 10 indicators. Now, if you look at Economic Survey, it says that for 2022, we calculated multidimensional poverty for 111 countries. And for India, we found out something very interesting. See, according to Economic Survey, approximately in the year 2005 and 6, 55.1% of our population was poor, according to UNDP Multidimensional Poverty Index. So more than half of India's population was suffering from multidimensional poverty. Now, in the year 2019-20, which means approximately 15 years later, we see that the ratio has fallen to 16%. So currently, approximately 16.4% of India is poor according to Multidimensional Poverty Index. If you look at numbers are staggering because India is a big country. So currently, for example, let's say our population is around 150 crores unofficially. So in 2005 and 6, roughly 65 crore people were suffering from poverty, and it has come down in 2019 to 23 crores, which means in last 15 years, number of people who have moved out of poverty is 42 crores. So there has been a reduction of 42 crores in terms of poverty in last 15 years. This is mentioned in the Economic Survey. And remember, India is also following sustainable development goals. One of the sustainable development goals says that by the year 2030, a country should reduce its poverty by 50%. And India is on its way to achieve that target. So guys, remember, we discussed that there are 10 indicators to measure multidimensional poverty. So let us see in which indicator India has done much better and in which indicator there is a scope to improve. So Economic Survey says that India has been able to perform good in all the 10 indicators, which means number of people who were not getting nutrition, it has come down. Number of people who are suffering from, school attendance, cooking fuel, sanitation related deprivation, that is also coming down. But if we look at the overall picture, we can see that in nutrition we have made good improvement. In cooking fuel, good improvement. Sanitation, good improvement. Electricity and housing, good improvement. Good as in compared to past, over a period of time, our performance has been better. Now let us look into various types of social sectors in India that is given in the economic survey. So we'll look at health, education and skill, employment, labor reforms, rural development, basic needs. We'll focus on water and power. But before we look at the developments in the field of health and education, we must look at the definition of social sector or social services. So economic survey says that social services includes education, sports, art, culture, medical and public health, family welfare, water supply, sanitation, housing, urban development, welfare of SCs, STs, OBCs, labor and labor welfare, social security and welfare, nutrition, and relief on the account of natural calamity. So guys, if this question is asked in GS paper 2 or if this question is asked in essay, so we must give the definition of social service that is given in the economic survey. Now let us look at the general trend of expenditure or the money that India has been spending on various social services. So you see, if you look at the data between 2017 to 2022, which means we are looking at last 6 years. So in the last 6 years, there has been an increase in total expenditure in India. So how much are we spending as a country? So look at this total expenditure. In 2017, 45 lakh crore and currently 80 lakh crore. So total expenditure has increased in last 6 years. Now, let us look at the expenditure on social services like health, education, labor reforms. Has that increased? So let us see. We can clearly see that between 2017 to 2022, there has been a doubling in the expenditure on social services, which means in the year 2017, the expenditure on social services were roughly around 11 lakh crores. Currently, it is around 21 lakh crores. So actually, the expenditure on social services in last 6 years has doubled, approximately. Now, let us look at this figure. So suppose guys, that the national income of India is 100 rupees. GDP of India is 100 rupees. Out of 100 rupees, how much are we spending on social services, social sector like health, education, out of the total national income of 100 rupees? So earlier we were spending around 6.7% or 6.7 rupees and now we are spending 8.3 rupees. So yes, there has been an increase. Now let us look at one more data. Suppose India is spending or government is spending 100 rupees in the economy. This is the expenditure of government. Out of the total expenditure, what percentage is going on social services? So if government of India is spending 100 rupees, from there, between the year 2018 to 2020, 3 years, 2018, 19 and 20, in these 3 years, approximately 1/4 of India's expenditure was going on social services, which means 25%. But from 2020 onwards, so 2021, 2022, the average expenditure out of total expenditure is around 26%. So if India is spending 100 rupees, out of that approximately 26 rupees is being spent on social sector. So remember guys, I told you that we will encounter a lot of data in economic survey and budget. From there we have to find out some data which we have to memorize, and we also have to look at trends. So what are we going to memorize from here? We should memorize 2-3 things, that what is the percentage out of total expenditure on social sector, roughly 26%, and out of our GDP, how much is being spent on social sector, around 8.3%. These two we have to understand, and we have to memorize these 3 trends. So UPSC might ask us a question that in the field of social sector expenditure, has there been an absolute increase in the expenditure? Yes. As a percentage of GDP also, yes, expenditure has increased. As a percentage of total expenditure also, our social sector expenditure has increased. So we have to memorize these 3. Now guys, let us look at the same thing in a slightly detailed manner. It is required for UPSC that we look at 1 or 2 important points from here. See, this table is given in the survey. Economic survey says that if the GDP of India is 100 rupees, which means the national income of India is 100 rupees, out of that, how much are we spending on the social sector? Earlier 6.6%, now 8.3%. Now, if the national income of India is 100 rupees, how much are we spending on education? Earlier 2.8%, now 2.9%. So expenditure on education has increased. In health, we were spending 1.3% earlier out of our national income, currently 2.1. But this 2.1 is also not sufficient, because National Health Policy 2017 and 15th Finance Commission have said that India should spend at least 2.5% of its GDP on health. Currently it's 2.1, and by 2025 we have to achieve a target of 2.5%. Looks as if we can do that. Now, suppose that the total expenditure of the government of India is 100 rupees. Out of total expenditure, how much are we spending on social services? Earlier, remember, average of 25. So 24.3% in 2015 and currently 26.6%. So out of total expenditure on social services has increased. Now, if India is spending 100 rupees total, how much out of 100 rupees is going on education? Earlier 10.4%, now 9.5%. This has come down. And it could be, as economic services, that it could be that due to COVID years, there has been a reduction in the, offline classes, etc., which could have reduced the expenditure. But this needs to improve. My personal take is that that's not a good trend. It must improve, because ultimately education and skill leads to employment. Now, if our total expenditure is 100 rupees, out of that, how much is going on health? 4.7 and currently 6.9. So it has improved. Now, guys, let us look at some of the developments in the field of health. Now, see, if you look at the number of registered allopathic doctors in India, it's roughly around 13,08,009 doctors. And how many doctors belong to the category of Ayush, Ayurveda, Yoga, Unani, Siddhi and Homeopathy? Approximately 5.7 lakh doctors. If you add them, 13 plus approximately 6. So we have roughly around 19 lakh doctors in India. Now, WHO said, World Health Organization says that for every 1,000 citizens in a country, there must be one doctor. So for every 1,000 person, one doctor. What is the ratio in India currently? The doctor-patient ratio. For every 834 people, we have a doctor. So actually, according to economic survey, we are doing far better than what WHO tells us in terms of doctor-patient ratio. Now, guys, in the current economic survey, they have given this picture where they are trying to capture what has been the development in the field of health between 2014 and 2021. So we are not going to look at this complicated set of diagram. We are going to look at the details from here in a simplified form. So, but before we do that, before we come to the different schemes by Government of India, let me tell you how you can use a very complicated table like this from economic survey to simplify and find out exam type of points from there. So let us look at this table. This table, for example, says improvement in health related indicators. So they have mentioned all the indicators related to health, and they have argued that in which indicator we are doing good, in which indicator we are not. So for UPSC purposes, the first thing that we should do is, if you look at all this carefully, you will see that in this table, there are only 3 reds, which means in only 3 indicators we are not doing good. And the rest of the indicators we have done well. And what is the year of comparison? So they are comparing 2019 performance with 2015 performance, right? So instead of memorizing in which indicators we are doing good, let us try to say in which indicators we are not doing good, because there are only 3 in number. So this is how we can first memorize the trend. And number 2, from here, which figures to memorize. So 1 or 2 figures we should memorize, which are very crucial for policy making. So this will help us to use the table. Let us see. So the table says that if you look at the population which is covered under health insurance, it has increased from 28% to 41%, so improvement. Then look at total fertility, which means number of children born to each woman on an average. Earlier it was 2.2, now it is 2. Now family planning method. So population which is using any family planning method, from 53% it has become 66%. Now, then it is saying that during pregnancy, what is the proportion of women who are visiting hospitals or healthcare centers? From 51%, it has become 58%. Institutional birth, so which means through trained staff and people in some hospital or healthcare center, the child delivery which is happening in India, from 78% it has become 88%. Then neonatal mortality rate. So for example, when a child is born, in the first 27 days, we observe a lot of child mortality and deaths in India. That is called as neonatal mortality rate. So from 29 it has reduced to 24. It's an improvement. Infant mortality rate, so it shows that if 1,000 children are born, how many children lose their life before attaining the age of 1 year. So from 40 it has become 35. We should memorize this figure, that currently it is 35. Then under 5 mortality rate, so before attaining the age of 5 years, how many children lose life? From 49 it has become 41. We should memorize these two. So we should memorize the infant mortality rate. We should also memorize the under 5 mortality rate. Then we have a figure related to nutrition. See, children under 5 who are stunted, which means for a particular age you should have a particular height. If you don't achieve that, you are called stunted. So the proportion of stunted children has reduced, but I think there is a scope of improvement here. Personal opinion. Now similarly, children under 5 who are wasted, which means for a particular height you should have a particular weight. Now that is body mass index. So number of children who are wasted, from 21 it has become 19. Again, improvement is there. Underweight means for age you should have a particular weight. The number of children who are underweight has also reduced. But I feel that these three indicators should improve little more in India. Why? Because if you look at the global hunger index, our rank is very poor there, which means there is a problem related to nutrition in India. Now similarly, if we look at the problem areas of India, so children under 5 years who are overweight, which means for a particular height you should have a particular weight. So if we look at the figure of children who are overweight, from 2.1% it has increased to 3.4%. Similarly, women who are overweight, so it has increased, and men who are overweight, it has increased, which is that if we have to find out some important points from this table, we can find out that for mortality, infant mortality and children under 5 mortality, yes, we have done good. But there is a problem of overweight in children, women and men. And as far as improvement is concerned, we need to improve in child wasting, child underweight and child overweight category. So guys, suppose that Indians are spending around 100 rupees on health. Out of this 100 rupees, how much is the contribution by government? When I say government, government means both center and state combined. And how much out of the 100 rupees that we spend in India on health is out of pocket expenditure by public? Out of pocket expenditure means the money that belongs to me. It is my earning. How much out of my own earning I'm spending on health? So in the year 2013-14, if India was spending 100 rupees on health, contribution by government of India, both center and state, was 28.6%, and out of pocket expenditure by public was approximately 64.2%. In the year 2018-19, the contribution by government is 40%, the contribution of public is approximately 48.2%, which means that nearly half of the total health expenditure in India is done by public through out-of-pocket expenditure. I think out-of-pocket expenditure can be reduced, not for a person like me, but for people who actually need it. So government should try to reduce the out-of-pocket expenditure. Now currently the contribution by government is 40.6%. In this, the contribution by state government is 26.67%, center 13.92%. Which means whatever is the total government expenditure on health, 66% is the contribution of states, 34% is the contribution of center out of total. So the ratio of center to state, right, the ratio is 66 to 34. So state is to center ratio, 66 is to 34. Now let us look at some of the important schemes related to health sector in India. We have already looked at Ayushman Bharat in the previous lecture, in the lecture series on economic survey. But let us just revise Ayushman Bharat. It is world's largest health related scheme. Under Ayushman Bharat, there are two things which are done by the government of India. First is preventive care and the second is protective care. Under preventive care, the government is trying to give primary health care facilities through health and wellness centers in both rural and urban areas. Under protective care, the government of India is providing health protection up to rupees 5 lakh per family per year, and this is for secondary and tertiary healthcare facilities. And if somebody needs hospitalization, etc., one can avail this scheme, and hospitalization facility in both government and private hospital can be availed. Now, there are some communicable diseases which can be controlled through vaccination. So, Government of India has started a program called Universal Immunization Program, where 12 vaccines are given free of cost. And to promote vaccination among children specifically, the government launched Mission Indradhanush in 2014. Now, we very well know that during COVID, India was one of the pioneers in the field of vaccines. So, India started world's largest vaccination program, whereby we provided vaccine of COVID dose to more than 220 crore people, which means that approximately 97% of the eligible population who should have been vaccinated, they actually got the first dose, and approximately 90% of the eligible population got both the doses. Only 10% people are left here. Now, India also created a mobile app for vaccination called as CoWIN app, where you just had to register using multiple IDs were allowed. For example, voter card, PAN card, Aadhaar card, ration card. These things were allowed. You could register and get the vaccine, and Government of India used to track the progress of vaccination. In fact, many countries of the world, they also asked for this mobile app for vaccination from Government of India, and Government of India made its source code open. Now, we very well understand that one of the problems during COVID was that people were not able to go out because of fear of infection and because of lockdown. So the Government of India also started a program called eSanjeevani, whereby sitting at home we can avail the telemedicine facility. So currently approximately more than 1 lakh health and wellness centers and more than 15,000 tertiary hospitals and medical colleges, they are providing this facility of telemedicine under eSanjeevani scheme. You know, in India, there is a problem which children suffer from, that is called as worming. So worms affect the intestine, and according to Nobel laureate Professor Michael Kremer, he says that if you suffer from intestinal infection due to worms, it not only has health related implication, but it also has economic implications as well, and it might affect your livelihood. How? So if intestinal infection happens in the children, they will suffer from two problems. The first is anemia, where there is lack of blood in the body, and the second is stunting. We have already seen that children under 5 who are suffering from stunting, which means less height for age, is almost 35% in India. So according to Dr. Michael Kremer, he says that because of worming, stunting and anemia can happen, and because of that there will be reduction in the cognitive function, because if there is no blood supply in your body, no oxygen supply, and lack of blood is there, your body reflexes, your intelligence will be affected, as well as it will lead to school absenteeism, which means your years of schooling will come down. You will not have the right knowledge and education and skill. And finally, it will impact the quality of life, because you will not be able to get productive employment. So ultimately, it brings down the overall performance of the economy. So it has both health implications as well as economic implications. So Government of India started to celebrate February 10th and August 10th as National Deworming Day from 2015 onwards, and the Government of India has started to use the tablet albendazole to treat children between 1 to 19 years for problems related to worming. Now guys, let us look at the rural healthcare structure in India. So rural healthcare in India can be divided into 3 different layers. Now there are 3 pillars of rural healthcare in India. The first pillar is called as sub-centers, the second pillar is called primary health center, and third pillar is called community health center. So the most basic pillar is called sub-centers. You see, sub-centers are the first point of contact between healthcare facility and the society. So suppose the government of India has to give message to the people about how to take care of women, children, pregnant women, how to take care against communicable diseases, right? So these are the basic things for which the government of India uses sub-centers. Now, every sub-center has one male and one female health officer. And for 4 to 6, sub-centers, generally 6 sub-centers, there is one lady health visitor who keeps visiting these sub-centers. So one lady health visitor takes care of 6 sub-centers. Now, let us look at the second layer. The second pillar of rural health is primary health care. In the primary health care, there is one medical officer and 14 paramedical. Paramedical are support staff. So there are 4 to 6 beds here, and there is no bed in sub-center, but there are 4 to 6 beds here. And here basically curative, preventive and family welfare related healthcare facilities are provided. Now let us look at community healthcare. So this is little specialized in nature. Here there are 30 hospital beds and there are 4 medical specialists and there are support staff as well. So which are the 4 medical specialists that you will find here? Surgeon, physician, gynecologist and pediatrician. These are the 4 specialists that we will find here. Now guys, let us look at the education sector. To understand the developments related to education, we are dividing it into 3 different categories. First is school education. Here we are going to study this trend related to school and then some schemes related to school. So I think approximately we are going to study 7 schemes related to school education. Then we will look at higher education. Here also we will first look at the trend and then we will look at 3 more schemes. And then we will look at skill development. Here also we'll look at trend and then 6 schemes. So total 16 schemes we are going to analyze for education sector. And guys, you know there is a difference between education and skill. So for example, suppose that there is a factory which requires workers for automobile production. So if I have the knowledge of, let's say, civil engineering, or I have the knowledge of economics or history, I won't be suitable for automobile industry, which means education is there, but skill is not there, which is being demanded by the factory. So the government should look at both education as well as the skill which is required for employment. So we are going to differentiate between education and skill. Now let us start from the school. You see there are some ratios and indicators which give us a good idea about the development in the education sector. For example, the first one is called enrollment ratio. Enrollment means number of students or children who have taken admission or registered in the school. Absolute numbers, that is called enrollment ratio. Then there is something called gross enrollment ratio. Now, so guys, suppose we look at standard 1 to 5th. Standard 1 to 5th is called primary. Now suppose there are 10 crore children in India who are eligible to get admission or enrollment between standard 1 to 5th. But out of 10 crore children, only 2 crore children are actually taking admission. So gross enrollment ratio is equal to 2 upon 10, which is 20%. So this is called gross enrollment ratio. And suppose out of 2 crore children who took admission, 1 crore children, they drop out, which means they discontinue going to school forever. That is called dropout. Right. Then there is a pupil to teacher ratio. So let us look at this ratio. So for example, guys, suppose somebody says pupil to teacher ratio is 34, which means for 34 children, there is 1 teacher. So if pupil to teacher ratio increases, it's not good, because pupil to teacher ratio means for that number of children, there is only 1 teacher. So if pupil to teacher ratio is 34, so for 34 children, 1 teacher. If this ratio is 50, then for 50 children, 1 teacher. So this ratio should come down. So if this ratio is low, quality of education is good. So let us see at primary level, which means standard 1 to 5th, upper primary 6 to 8 and secondary 9 to 10. Let us look at the performance. So enrollment ratio for all the 3 levels of schooling has increased. Gross enrollment ratio has also increased. School dropout has come down. And pupil to teacher ratio actually is getting down. When people to teacher ratio comes down, quality of teaching or quality of education goes up. So see, for primary level, earlier the people to teacher ratio was 34, now it's 26.2. For upper primary from 23 it has become 19.6, for secondary 30 to 17.6, which means it is improving. We all know that the government of India has started a new education policy from 2020 called as NEP. Now, this new education policy stands on 5 pillars. What are the 5 pillars? First is access, which means that our schools and education system must be accessible to the students. Equity, we should not discriminate. Quality, the quality of education must be good. Affordability, it should not be so costly that a section of the society is not able to afford it. And then accountability, to maintain the standards, somebody must be accountable. These are the 5 pillars. Now, what is the new system of schooling that we have developed? It is 5 plus 3 plus 3 plus 4 system of education that we have developed. The first 5 years are called as foundational stage. What happens in the foundational stage? So play-based activity using toys, etc. And we are trying to teach basic learning and language to the children. The next 3 years is called preparation stage. In this stage also, we use play, activity, and mostly interactive based learning, where we teach higher level of language plus mathematics. Basic maths is also introduced. The next 3 years is called middle stage, and here we try to develop the critical thinking in the children by introducing more variety of subjects like physics, social science, maths, arts, and humanities. And then the next 4 years is secondary stage, where we allow multi-stream system. So if somebody wants to study economics with physics, it is allowed. If you want to study English or Hindi literature with chemistry, it is allowed. So which means different combinations are allowed. And in our new education policy, the National Education Policy 2020, so there are multiple points of entry and exit. So if you want to discontinue at a certain stage, so you can drop out and then you can pursue some work and then you can come back and continue your education as well, which means continuity can be maintained there. Now, to promote the foundational stage learning, the government of India did an experiment. So in Kendriya Vidyalayas, so the government of India has selected some KVs, Kendriya Vidyalayas, and started Bal Vatika. Bal Vatika has been started in Kendriya Vidyalayas to promote this foundational stage learning, which is the first stage. The government has also started a program called as PM School for Rising India. What is that? Now, PM School for Rising India is like a lab whereby the government is implementing this 5 plus 3 plus 3 plus 4 system of schooling. So suppose that there is a school which is in a particular area. The government of India has introduced this system here as a model school where all the right infrastructure will be there, classrooms, smart classes, etc. Plus it will be environment friendly, so water harvesting will be there. We will try to use more environment friendly energy, waste management, all these things. This school will act as a role model, and this school will give mentoring to other schools in the vicinity so that they can also adopt this new system of schooling that we have introduced. This scheme is called as PM School for Rising India. Now, government has also started a scheme called as Samagra Shiksha scheme. Samagra Shiksha scheme is like a holistic scheme for the development of schools as well as effectiveness of a school under National Education Policy 2020. So here the government is trying to create an ecosystem from preschool up to the later stage of school, so that these points can be covered in the schooling system. So for example, administrative reforms, increasing fund for education, quality, digital education, school infrastructure, giving importance to girls' education, creating more space for physical education in the school. So we are trying to create this ecosystem from preschool to the later stage using all these points. Under Samagra Shiksha scheme, the government of India has launched Prashast mobile app. And what is the job of this mobile app? The job of this mobile app is to find out the level of disability in the school children. That disability is then reported to the authorities and they issue certificates. So that is done under Samagra Shiksha. Now there is a scheme called as STARS, which is Strengthening Teacher Learning and Results for States. This scheme is being launched with the cooperation between central government, state government and World Bank. This is a 5-year project which will last until 2024-25. 6 states are participating in this project. So Himachal Pradesh, MP, Rajasthan, Maharashtra, Odisha and Kerala. They are trying to improve the quality of education and governance of the school education in these states. There is a very innovative scheme called as Vidyanjali. So under that, the government and government aided schools, they are open to receiving help from the private sector and the community. What kind of help are they looking for? So for example, guys, suppose that you are an individual or you are a company, a private sector, and you want to contribute by giving maybe digital boards, computers, etc., different kind of assets to the school. Or maybe you are an individual and you have great knowledge about a particular subject. You want to contribute by teaching in that school. So in whatever way you want to contribute to your skill, knowledge, capital or assets, you can contribute to the government and government aided school. So this scheme is called as Vidyanjali. So now let us look at some of the developments related to higher education in India. Now, in the year 2016 and 17, around 3.6 crore students were enrolled in higher education. In 2020, it has increased to 4.1 crore. So yes, number of students enrolled in higher education has increased. Now let us look at the male-female ratio in the higher education. There are more males than female in the higher education. So out of 4.1 crore students enrolled in higher education, 2.1 crore male and 2 crore female. So it is slightly skewed towards male. This should become more equitable. Now let us look at the number of teachers. The number of teachers over a period of time has also increased, but we need more teachers. As you can clearly see, the increase is not that great. Plus, look at the ratio of male is to female teachers. We can clearly see that there is gender inequality. So out of 15.5 lakh teachers, 8.9 male and 6.6 female. So this ratio also needs to improve, which means we need to encourage our women population to participate more in education sector. Now there are two interesting things in the higher education. The first is 2 programs simultaneously. So under the National Education Policy 2020, Government of India has allowed students to pursue 2 programs at the higher education level simultaneously. For example, if you are pursuing your graduation in history, simultaneously you can also pursue your studies in economics if you want. So, and how can you pursue 2 simultaneous courses? So either both courses online, both courses offline, or one online, one offline. So 2 academic degrees can be pursued simultaneously. Then there is interest subsidy on education loans. So suppose guys that you belong to economically weaker section, the parental income is less than 4.5 lakhs per annum. And suppose you want to pursue engineering, you can take loan without any collateral. And suppose it's a 4-year degree that you are trying to pursue. So for your 4 years plus 1 grace year period, 5 years, you won't have to pay any interest rate on your loan. And this is applicable only when you pursue your higher education in some Indian college or university. Now guys, let us look at various schemes by Government of India through which the government is trying to improve the skill and employability of our youth. So see, Ministry of Skill Development and Entrepreneurship, MSDE, they actually launched Skill India Mission 2015. Under Skill India Mission, the Government of India through Ministry of Skill Development and Entrepreneurship, they are running these 7 important schemes. So for example, the first scheme is Pradhan Mantri Kaushal Vikas Yojana, Jan Shikshan Sansthan, National Apprenticeship Promotion Scheme, Craftsman Training and Instructors Training, and there are 2 more schemes. Now under National Education Policy 2020 as well, the government has paid due attention to vocational training and skill development from school level itself. So if UPSC asks you a question that what are we doing for skill and employment generation, so we should write these 2 things, that under Ministry of Skill Development and Entrepreneurship, we are running Skill India Mission and new education policy that we created called as NEP, National Education Policy 2020, that has also paid attention to vocational training in India. Now let us look at all these programs one by one. So the first one is called as Pradhan Mantri Kaushal Vikas Yojana 2015. So see, It has been launched by Ministry of Skill Development and Entrepreneurship, but it is being implemented by National Skill Development Corporation, NSDC. What is it doing? It is actually doing three things. So suppose you are a school dropout, right? Or suppose that you are unemployed. So the government of India, through PM Kaushal Vikas Yojana, will provide you training in soft skill, financial literacy, digital literacy, and entrepreneurship, so that you can also attain some livelihood related skills. And then the government of India will give you certificate. You can use that certificate to pursue employment. But suppose that you have been working in, let's say, an automobile company and you don't have any degree, but you are working in a workshop. As a worker, you have acquired some skills over last 5-10 years as a mechanic. Now the government of India says that they will test your knowledge of being a mechanic, and they will bridge the gap if they feel that if there is something missing in your knowledge, they will give you that training, and then they will give you certificate, which means the government is also giving recognition to prior learning. So first, they are training you through short-term courses, and second, if you already have some knowledge through experience, not through degree, government of India will test you and certify that yes, you have the right knowledge. And the third is a special project. So for example, government of India is running a program related to solar energy, where the government is giving solar cells to different households, and government needs people who have some idea of solar cell, how to install it, etc. So the government of India is saying that government will train the people with some special skills so that they can get employment in specific government jobs and private jobs as well. So three things: short-term training, recognition of prior learning, and special projects. This is being done under Pradhan Mantri Kaushal Vikas Yojana. Now, Jan Shikshan Sansthan scheme has been launched by government of India so that the government can give grants to NGOs, and NGOs are going to give skill training to non-literates as well as new literates, people who are dropouts and who just had basic level of schooling. Here the priority is to provide skill to SCs, STs and OBC. Then the government of India is also giving financial help to those industries who are giving employment to the youth. So the youth can get employment and on-the-job training, that is called as apprenticeship. So government of India identifies such industries and gives them financial help to promote apprenticeship programs. Then there is a program called as craftsman training and instructor training. There are 92 lakh students in India who have got the benefit of something called as Industrial Training Institutes, ITI. See, there is a course called as engineering where you get the engineering degree. If you are unable to do that but you have the right aptitude, you can also enroll for ITI programs where they will give you diploma. So for example, they will train you in electronics, mechanical, electrical, all these different kinds of activities. They will give you certificate and you can get employment. Roughly around 92 lakh students have got the benefits. Now, the government of India has also started Skill India International Network. This is very interesting. So government of India is saying that why should India only provide goods and services to the world? India should also provide skilled workers and labor force to the entire world, because we have demographic dividend. So the government of India says, why can't we train our workers so that they can also get international exposures based on whatever is the international demand for skill. Recently, government of India has signed MOUs with 11 countries so that we can train Indians to fulfill the demand from these countries in terms of skilled labor force. So I remember that government of India started one of the training programs in UAE, so that our workers whosoever are there, the government of India is training them so that they can get better employment in UAE itself. So government is creating a network of such institutions. Both government and private institutions are participating in it, called as Skill India International Network. Now, there is a program called as Skill Acquisition and Knowledge Awareness for Livelihood Promotion, called as Sankalp. So see guys, whenever we talk about skill generation in India, there are multiple programs. So first we need to coordinate between various skill development programs. Number two, we need to see who are the instructors, because if the quality of instructor is not good, what will happen to the quality of the program? And third, we have to create the right infrastructure. So coordination between various skill related programs. Number two, instructors. Number three, infrastructure. And number four, designing the course for skill development in India. So this program called as Sankalp tries to create such a system whereby all these things are taken care of. Now guys, let us look at a very crucial discussion given in the economic survey, which is related to employment. The current economic survey discusses employment from two different angles. First is demand side, which means that who creates the demand for employment. And second is from the supply side, which means are the workers available to work. So let us see, economic survey has divided employment from two sides, demand and supply. And economic survey has given an example. It says that if you want to find out that who is creating demand for employment, we can use data from periodic labor force survey, PLFS, which is conducted by Ministry of Statistics and Program Implementation. And to look at the data of supply side, we can also look at annual survey of industries, which is conducted by Ministry of Statistics and Program Implementation. So based on these two sides, we will get a clear picture of the employment. So let us start from the demand side. You see, Labor Bureau, it performs a survey called as Quarterly Employment Survey, QES, whereby Labor Bureau goes to all those industries which provide employment to more than 10 workers. So if 10 or more than 10 workers are working in the industry, Labor Bureau goes for a survey, but it covers only 9 sectors. Which are the sectors? Manufacturing, construction, trade, transport, education, health, accommodation, restaurant, IT, BPO, and financial services. So in these sectors, if there is an industry which is giving employment to 10 or more than 10 workers, then Labor Bureau conducts the survey and tries to find out that are more workers working in these industries today compared to earlier days. We find out that total employment in these 9 sectors, which means these sectors are creating more demand. So total employment in these 9 sectors have increased to 3.2 crores. And this is greater than the employment given in 2021. So they have created more demand for workers. Now, where do we find a greater increase in employment? In IT sector, health and education. Now, if you look at these 3.2 crore workers, what is the type? What are the different attributes of these workers? So if you look at these 3.2 crore workers, out of them, 68.2% are male and roughly 31.8% are female. So they are dominated by male. So male workers are getting more employment in these 9 sectors. Now, out of these 3.2 crore workers, 1.9% are self-employed and 98% are salaried. Now, out of these 3.2 crore people, regular employment is 86.4%, which means they are working on salary on regular basis, and 23.6% are contractual, which means they have got work contracts only for a limited time period, which means that regular employment is more, contractual is slightly less. So this is the nature of these 3.2 crore employed people. Now, let us look at this data collected by Annual Survey of Industries for 2019-2020. So, the Ministry of Statistics and Program Implementation, they have done this survey to find out what is the type of employment created in organized manufacturing sector. Now, under organized manufacturing sector, if somebody is getting employment, they will get social security benefits, they will get minimum wages as per government rules, etc. So let us see where employment is being created. So economic survey says that employment in organized manufacturing has increased over a period of time. In the organized manufacturing, what is the contribution by food industry, food processing industry? 11.1%. So out of the total organized manufacturing that is there in India, food processing industry gives employment to 11.1% people, which is more than 10%. Apparel industry, clothing 7.6%, and basic metal 7.3%. If you look at the state-wise data, Tamil Nadu is the #1 state in terms of organized manufacturing employment generation. But there is one interesting point given in the economic survey, which I feel can be asked in the exam. It says that if you look at manufacturing sector, there are 2 types of industries. One small industries and one is big industries. Economic survey says that the bigger industries are creating more employment in organized manufacturing. Smaller industries are creating less employment. So that is one of the facts given in the economic survey. The Atmanirbhar Bharat Rozgar Yojana, which started during COVID, the government of India has been trying for two things. One, to create more employment, and second, the employment that we create should also lead to more social security benefit to the workers. And any industry or factory which is doing this, which means they are creating more employment and giving social security benefit to the workers, the government of India is giving them some kind of incentives. So that is Atmanirbhar Bharat Rozgar Yojana. Now let us look at the increase in workers who have subscribed to Provident Fund. Provident Fund is social security benefit. So we can see that in the year 2022-23, there has been a jump in the workers who have subscribed for Provident Fund scheme, which means that organized manufacturing plus social security both are increasing together as was planned by the government of India. Now guys, let us look at the development related to Manrega. See, under Manrega, the government of India provides 100 days of guaranteed wage employment to every household who is willing to work and which demands work. And if you don't get work after demanding for 15 days, then government provides unemployment allowance to those people. Now let us look at some of the developments related to Manrega. You see, during COVID, the demand for Manrega job increased all of a sudden. Why? Because during COVID, workers were returning from cities and towns to their villages, and two kinds of activities were going on. One, agriculture, and second, Manrega related work. So whenever there is some sort of economic crisis or lockdown, etc., we observe that the demand for Manrega related work increases all of a sudden. But then we see that in the year 2022-23, the demand for Manrega jobs got stable and it got very close to the pre-COVID level. Under Manrega, there is one thing which is very unique, that the participation of women workers is more than men workers. So female participation is more than male. Female is 56.3%, male 43.7%. And this question has been asked in UPSC already 6 years back in prelims. Now, under Manrega, the government has done two interesting things. One is called as Unnati scheme. What is Unnati? So, suppose some workers are working under Manrega. Example, the migrants who came back during COVID. So, the government of India started to give them basic skill also to improve their skills so that their temporary source of livelihood should become permanent source of livelihood in future also. It's basically skill building exercise. There is another scheme by government of India called as barefoot technicians, BFT. So we know that under Manrega, different kind of asset creation goes on in rural areas. So the government of India picks up the people who are working under Manrega and gives them training, for example, in basic civil engineering concepts, so that whatever assets they are creating, so it could lead to a better asset creation and good quality of assets in the rural areas through these technicians called as barefoot technicians. The government has also started a national career service scheme in 2015. So under that, we have started a portal called as National Career Service Portal, whereby those people who want to get jobs, they are called as job seekers, they have to register themselves. And those institutions or organizations or companies where there is opening and they require some workers in their factory or their offices, they post their requirement. They are called as employers. So roughly on the National Career Service Portal, 6.8 lakh employers have registered themselves and 2.8 crore job seekers have registered. Now on this portal, actually the demand meets supply. So those people who are looking for job, they are connected to people who are looking for workers. So it acts like a bridge. Now under the National Career Service Portal, a training program has also been designed called as Digi Saksham program to improve the skill related to jobs in the job seekers. Now there is one new addition in the National Career Service Portal. So international jobs and openings are also posted here. So if you are interested in that, you can register here and get placed. So now let us look at the employment from supply side. So see, in the year 2017, NSO started the Periodic Labour Force Survey in India. And in this survey, they report two things. Number one, some ratios like labor force participation rate, unemployment rate, and workers population ratio. So there are these three ratios, and then they also report different ways of measuring employment. For example, usual status and current weekly status. Let us first look at what is labor force participation rate. These are all supply side, which means are workers ready to supply their services. So labor force participation rate means that out of the working age population, how many people are actually working or looking for job or available for work. So this talks about availability or supply of workers. Then we have another ratio called as WPR, worker population ratio, which talks about how many people are employed out of the total population. And this ratio talks about number of unemployed people out of the total labor force. Now, what is the method that NSO uses to measure employment? So two methods are used. First is usual status. Second is current weekly status. So guys, NSO would ask a question to you. So they would say that in last 365 days, did you actually perform an economic activity for at least 30 days in last 1 year? If yes, then you will be called as employed according to usual status. Now, according to current weekly status, they would ask you a question that in last 1 week, was there any day where you performed economic activity for at least 1 hour? If yes, then you will be called as employed according to current weekly status. Now let us look at the performance of India in terms of employment and these ratios, both male and female. So you see, if you compare 2018-19 to 2019 to 2020, if you compare these 3 years, we see that in male, the labor force participation rate has increased. In rural area, urban area also, WPR ratio has also increased. So number of workers out of total population, and unemployment rate has come down. For female also, LFPR, labor force participation has increased, work population ratio has increased, unemployment rate has come down, which means there has been an improvement. Now, economic survey says that if we compare year 2017 with 2018, 2019 and 2020, these 4 years, we observe that the number of self-employed people in India has increased. In our total workforce, self-employment is increasing, and this is regular wage or salary. So this employment is coming down, and casual workers or contract-based workers, that is also coming down. Now, economic survey has given a data. Economic survey has said that in the field of agriculture, the employment has increased from 45% in 2019, 45.6 to 46.5 in 2020. So agriculture is providing more support and more employment. In manufacturing, employment has come down from 11.2% to 10.9. In trade, hotel and restaurant, these are services, employment has reduced in 13.2 to 12.2. Economic survey also says that these two are showing bad performance because of the effect of COVID. In construction, which picked up after the lockdown got removed, so the construction sector has picked up, and here we are seeing little more employment. Economic survey then talks about quarterly report of PLFS, periodic labor force survey, for urban areas. And for urban areas, economic survey says that the labor force participation rate, see, it has increased, this ratio. It says worker population ratio, it has also increased. And economic survey says that unemployment in urban areas is coming down. Now guys, let us do a recap of what the labor reforms are which have been introduced by the government of India in the year 2019 and 2020. So the labor reforms contain basically 4 codes. So earlier we had so many different acts which used to regulate the workers, their working conditions, salaries, etc. All of them have been reorganized into 4 different categories now. So the first code is called as the Code on Wages 2019. So this code talks about what should be the minimum wage of workers, how payment should be made. So for example, during COVID, offline payment was not possible. So online payment system was allowed under this. And it also says that there should be no discrimination between men and women when they perform the similar job or same job. The second code is Code on Social Security 2020. It gives power to the center to notify various social sector schemes like provident funds for the benefit of workers, and it also gives center the power to launch schemes related to self-employment. The third is industrial relation code. So we have seen, guys, that many a times, so for example, the companies would hire workers on casual basis or contract basis, and they are exploited. Their working hours are more and their payments are low. So this industrial relation code, it says clearly the definition of skilled, unskilled, permanent, contractual workers, and it also talks about how they should be compensated. Now, the fourth one is occupational safety, health, and working condition code. So it says that in the workplace, the hazards should not be present, which might affect the health of the workers negatively. And it also says that there must be annual health checkup of the workers. Guys, now let us look at rural development, because it has been discussed in this topic of the economic survey in a detailed manner. Economic survey says that in 1960s, around 80% of our population in India was rural. As close as 2007, approximately 70% population in India was rural. And in 2021, close to 65% population in India, even today, is rural. Yes, we are becoming urban very fast, but even today, 65% population is rural. Economic survey says that the government of India, for regional planning and for rural development, has launched a lot of schemes. Let us discuss some of the important schemes. So guys, the first scheme that we'll discuss is Aspirational District Program, and second is Rashtriya Gram Swaraj Abhiyan. Now, under Aspirational District Program, what the government does is, it has given the responsibility to Niti Aayog to go to different states of India. So let us take an example. Suppose this is a state. In this state, see, there are different districts. Some of the districts are performing good in terms of health, education, employment, etc. And some of the districts are not performing that well on social indicators. Niti Aayog will come, and using social indicators like health, nutrition, education, it will identify those districts which are low performing. Those districts will be called as aspirational districts. Then Niti Aayog will find out which is the best district in the state. Under Aspirational District Program, the first thing that we do is we try to improve the performance of low performing districts so that they are able to match the best district in the state. So aspirational districts will be improved so that they also get to the level of the best district in the state, and their improvement does not stop. Then we keep on improving that district so that now they become the best in the country. So first we identify the low performing districts in a state, and we try to raise their standard to the best district of the state, and from best district of the state we try to take them to the best district of the country. This is Aspirational District Program. And when these things are happening, Niti Aayog tries to provide ranking, monthly ranking to these aspirational districts in terms of 5 indicators like health, education, agriculture, financial inclusion, and basic infrastructure, just to know in which direction they are moving. These 5 indicators, or these 5 themes rather, they are divided into 49 key performance indicators. So inside these 5 themes, there are 49 performance indicators which will tell us what is the current level of performance of these aspirational districts. We also have a program called as Rashtriya Gram Swaraj Abhiyan, under which the government of India is trying to improve the functioning of the Panchayati Raj institution so that they are able to achieve the sustainable development goals for overall the regional planning. And a special focus of Rashtriya Gram Swaraj Abhiyan is on aspirational districts, so that we are able to achieve the sustainable development goals of financial education, financial inclusion, reduction of poverty, provision of employment, clean drinking water, and all these things. Now guys, there is one more program called as Deen Dayal Antyodaya Yojana, National Rural Livelihood Mission, NRLM. This program says that we have to provide skill to the rural workforce, especially to the women, in such a way that we are able to generate self-employment and skill-based employment for every household. Now, this program has 4 components. First is empowerment of rural women, and through this program, approximately 8.7 crore women have been covered. The second component is financial inclusion or financial empowerment. The third is sustainable livelihood. And sustainable livelihood can be provided only if we provide the right skill to the public. And the next is social inclusion, which means that we have to make sure that whatever benefits or programs we have created for economically weaker section, so that benefit or government scheme directly reaches them. For example, in India, we have direct benefit transfers, through which the direct transfer of subsidies or cash that the government wants to provide to the poor, it directly reaches in their bank account. So these are the four components of National Rural Livelihood Mission. So basically here, using this program, we are trying to create self-employment through skill building. There is another program called as Deen Dayal Upadhyay Gramin Kaushal Yojana. Under it, we try to create wage employment for the public. So this program, National Rural Livelihood Mission, was a program where we were trying to give a skill to people to create self-employment. And under Kaushalya Yojana, we provide skill to people to give them wage employment. Now guys, let us look at some basic necessities of life like water. So Government of India has started a program called as Jal Jeevan Mission in 2019, where the aim of the government is to provide tapped water connection to every household and public institutions like Gram Panchayat, the schools, hospitals. Here the center and the state, they have become partners, and they are trying to provide the tap water by 2024. We have another scheme called as Mission Amrit Sarovar, which was launched in 2022. Here the Government of India is trying to rejuvenate 75 water bodies in every district, because we are excessively using water in our development of infrastructure and urbanization. So government is trying to rejuvenate these 75 water bodies in every district. Then the Government of India has also launched Jal Doot mobile app in 2022, through which the Government of India measures water level in Gram Panchayat twice a year. Once we measure the water level, then we can replenish the water and maintain the groundwater level at a certain depth. So now guys, let us study Swachh Bharat Mission, which was launched in 2014. In stage 1 of the Swachh Bharat Mission, the Government of India wanted to make all the villages of India open defecation free, and the government achieved that. So all the villages between 2014 and 19, they got the status of open defecation free villages. In the second stage of Swachh Bharat Mission, we are trying to do two things. So every state government has been motivated to maintain the status of open defecation free villages, what they achieved in stage 1. And we are also trying to motivate the state governments to create solid and liquid waste management in all the villages. So if in a particular state, all the villages are able to maintain the open defecation free status plus create solid and liquid waste management facilities, then the status of that state will be raised from ODF to ODF plus. Right? So for example, Andaman and Nicobar's Islands. So there all the villages are open defecation free plus, which means they have achieved two things, ODF and solid and liquid waste management. So Andaman and Nicobar Island is also called as Swachh Sujal Pradesh. So guys, we have one scheme called as Saubhagya scheme, which was launched in 2017. Here the aim of the scheme is universal electrification. So under the scheme, the Government of India is trying to provide electricity connection to all the willing unelectrified household in rural areas, plus a willing poor household in urban areas. And for poor households, the electricity connection will be free, and those who can pay for them, 500 rupees will be the charges which they can pay in installments. Now guys, we have another scheme called as Swamitwa scheme for rural areas and villages. Now imagine this, that one day you have gone out for work. When you come back to your work, to your house from your work, somebody is already there and that person says that that house belongs to that person and not you. How would you feel? You will feel cheated. And then that person will say that show the property papers. And then you will realize that this house was gifted to you by your great-grandfather, then father, but there is no authentic paper, even though that is your house. So this can happen to you if you have a house, if you have a land. So Government of India says, why not make the land records and the records of ownership of the house systematic in the village areas to avoid disputes and also to make it more systematic. So the Government of India started this program called Swamitwa scheme to provide record of rights to village household owners possessing house in rural areas, where the aim is to create accurate land records, reduce property disputes, and also, guys, imagine that if I have my property papers, and if I want to rent out my property, I can. That is called monetization. Unless I have authentic papers, I can't rent out. So the government of India is trying to create official authentic record of rights for the villages who own these assets like houses. Now guys, let us try to look at some of the important developments related to climate change and environment. So the government of India started a program called as National Green Hydrogen Mission 2023. You see, the world is constantly looking for renewable sources of energy. And we are also looking for those type of fuels which have zero carbon emission. So one of those fuels is hydrogen. Hydrogen can be used in aviation, chemical manufacturing, shipping, etc. It has multiple uses. We can also run our automobile on hydrogen. But how to get hydrogen as a fuel? So you see, what we can do is, for that we need electricity. So suppose that we get our electricity from solar power plants or wind energy. So this is not coal-based electricity. So we get electricity from here, and then we pass this electricity in a container full of water, right? So when you pass electricity, this process is conducted in electrolyzer. So this container is called electrolyzer, and this process is electrolysis. So once you pass electricity in water, the water molecule breaks down into hydrogen and oxygen. Then we can collect the hydrogen in a cylinder like this. Now our hydrogen fuel is ready. We can use it in multiple places. It has multiple applications. This hydrogen which we have got using electricity from solar energy and wind energy is called green hydrogen. But suppose we would have conducted the same process by using electricity from thermal power plants or other sources, then that would have been called as gray or black hydrogen, because the source of electricity is different. So government of India is also trying to create green hydrogen. Currently, if you look at the world, less than 1% of the global hydrogen is green. Government of India plans that by 2030, we would be able to manufacture 5 million metric tons per annum of green hydrogen through this mission called as National Green Hydrogen Mission. Then economic survey also talks about green bonds. So guys, suppose that we have to conduct a business which is related to renewable energy. For that business, we need cash. To get that cash, we can launch a bond called as green bond. So what is so special about green bonds? Green bonds are those financial instruments which are created to raise capital, and this capital will be invested in environment friendly businesses and practices and projects. Now the world is using a lot of green bonds. India is also using green bonds. So for example, 15 different companies in India, they issued green bonds and they raised around 4,539 crore rupees in India. And in fact, in the budget 2022-23, last year's budget, the government of India also talked about issuing sovereign green bonds, which means it will be issued by government of India and the money collected through it will be used in environment friendly projects by the government. NRIs are also allowed to invest in the sovereign green bond. Now guys, let us study leadership group for industry transition, lead IT. You see, this was started by India and Sweden with the support from World Economic Forum in 2019. What are they saying? There are some industries, guys, for example, chemical industry, paper industry, automobile industry. There are some industries which use a lot of energy in their production. And the energy that they use, according to India, Sweden and World Economic Forum, the energy that they're using leads to a lot of carbon emission. So lead IT is saying that energy heavy industries which use a lot of energy, they should also start to move away from polluting kind of energy to that energy which reduces the carbon presence in the atmosphere, and ultimately they should use that kind of energy which will lead to zero carbon emission. So basically they are trying to motivate the energy intensive industries to move away from carbon emission to zero carbon emission kind of methods of production. And guys, this is not the first time that India has taken some initiative towards the renewable energy. If you remember, India is also the pioneer of International Solar Alliance, where they are trying to motivate the entire world to use more solar energy. And with this, we conclude our Economic Survey Lecture Series 2022-23 and hope that this knowledge helps you to understand India and world in a better way and also to get good marks in the exam. Thank you so much. All the best. God bless you and see you next year with the new series on Economic Survey.